Hey guys, so I was supposed to do the presentation on aggression, and unfortunately, I woke up really late today, so I couldn't make it to the revision class. So I did find one question in 2017 Block 2 exam, and it asked what was the immediate management for an aggressive patient at a health center. And so if you don't want to watch the whole video, you could just probably see the way I answered it, and if you've got any thoughts or comments on this, you could probably just put it up in the chat. So I'll just scroll down so that you guys can see the complete answer. Right, so this is how I would have answered the question. 5 steps, and sorry. After that, this is something extra that I thought of adding to the answer, and then of course the part where it talks about risk assessment for an aggressive patient. Alright, so right, going on to the explanation of the answer. So firstly, I would assess the danger, and that's the danger to self and the danger to the patients. So if there is danger to self, I'd want to leave and run, and I think Dr. Allen also advocated on the same advice. Okay, or if you see that the aggressive patient is harming another patient, so that's when you call for help and evacuate the other patients. Right, so that was the first step, and that is to assess danger. And once you have assessed danger, you can actually call for help, or you could call for help even beforehand. Right, so in some instances where you call for help, the aggravated patient gets more aggressive or gets provoked, so assess. Right, so call for help, and this may be needed in possible restraining of the patient. The third step, and this is what Dr. Allen also talked about, try to de-escalate. So de-escalate if you feel that the threat posed by the aggressive patient is low, and also de-escalate if you know you are well versed with de-escalating techniques. Right, so those are the 2 instances where you would try and de-escalate. And when you de-escalate, you simply use behavioral strategies. So this is what I came up with. So the first idea is to remove any provocation. So if they are provoked by something, you could either physically remove, or if the patient is provoked by another patient or something, you could ask the other patient to go away. So that gives the aggressive patient the physical and emotional space. The next bit is to acknowledge that the aggressive patient is distressed, but without making any accusations. And the other bit you should be trying to do when you're de-escalating is to make a compromise with the aggressive patient. So those are the things you would want to do when you try and de-escalate the situation. The fourth step is, once you've de-escalated enough and you've seen that the patient has calmed down, you could actually ask someone to just hold the patient, or if the patient hasn't calmed down, still aggressive, but somehow you've gotten help and people have restrained. So this is the physical restraint part. Once you've restrained, then you should opt for rapid tranquilization. Right, and this is basically sedation. Now the important thing to remember about sedation is that sedation should be effective. Right, so the dose of the sedative that you are giving should be effective, but at the same time it shouldn't be harmful. So the things that we worry about are especially respiratory distress if you're giving a sedative. So I came across the National Institute This is the British guidelines for aggressive patients, and this is the drug guidelines that were advocated in this document. So it says, for highly aroused or physically robust patients, or those patients who are known to be on any antipsychotic, the first drug of choice is usually lorazepam, and that's 2 milligrams. Right, so in the first try you should give lorazepam 2 milligrams and see if the patient gets sedated. If not, repeat the lorazepam 2 milligram dose, or you could give haloperidol 5 milligrams. So maximum in 24 hours is lorazepam 4 milligrams and haloperidol 12 milligrams. Right, for those patients whom you suspect are either on alcohol intoxication or alcohol withdrawal, the drug of choice is still lorazepam 2 milligrams. Second try is repeat, but the only alternative is, the only drug for choice in these patients are lorazepam 8 milligrams. Okay, and then lastly, once you've sedated the patient, you want to stabilize patient. So stabilize patient means to either hydrate the patient or see what's actually caused the patient to become aggressive. Right, so simply stabilize patient and refer appropriately, right, and of course with the help of law enforcement. So this is how I would answer the question. Now in terms of knowing why the patient is aggressive, that's important, I feel. And so there's a mnemonic that's used, and it's called move stupid. So move stupid, basically M stands for any metabolic causes, so that's either your renal, liver, electrolyte, or either your hyper or hypoglycemic. R stands for hypoxemia. V is for any vascular phenomena such as stroke, subarachnoid bleed, or vasculitis. E is for endocrine, so think thyroid, and also think adrenal glands, especially in pheochromocytoma where patients are known to be aggressive. So that's move. S stands for seizures, so usually in the post-ictal phase sometimes they can become aggressive. T is for trauma, and you'd worry about concussions or anything. U is for uremia, so this is particularly in renal failure. P is for primary psychotic disorder, so if they are known to be having a psychological illness. Right. I is for infection, so the thing you're worried about here is meningitis. Right, it could be pulmonary or sinusitis as well. And finally D is for drugs, so either they are going alcohol intoxication, alcohol withdrawal, or whether they've used some recreational drugs, or whether they simply were not compliant to their antipsychotic medications. So yep, there you have it. Move stupid, mnemonic to remember the causes of why a patient might become aggressive. Finally, this is to assess the risk, and I think this was also mentioned by Tony. Oops. Come on. Alright, so there it is. So risk. So the way I find it easier to remember is just to know the factors that are important to know in risk assessment. So these are your demographics.